So today's topic is respiratory infections. If anyone is joining late, please help them out with today's topic name. It's not from the textbook. These are just additional classes, extra classes. Not for exams, not from the textbook, just for your knowledge. Okay. So what is a respiratory infection? Your respiratory tract, it starts from your nostrils, okay, and it ends at your alveoli. Alveoli are the air bags in your lungs, okay. So that is your entire respiratory tract. So a respiratory tract infection that affects the respiratory system. This is the part that is involved in your breathing, responsible for your breathing. So these infections can take place either in your sinuses, throat, lungs, or airway. Okay, there are two types of respiratory infections: upper respiratory infection, lower respiratory infection. Okay, in the upper respiratory infection, upper respiratory tract is your nasal cavity, your nose, your sinuses, okay, your pharynx, larynx, that all come under the upper respiratory tract. Below the larynx, larynx is the sound box, okay, voice box we say in your throat. Below the larynx, your trachea will start, then your bronchi. Trachea will split into bronchi. Okay, bronchi will further split into bronchioles, the small branches of bronchi that ends into alveoli, that is the airbags. Okay, so these are the two sections of your respiratory system: upper respiratory tract and lower respiratory tract. So, what is an upper respiratory tract infection? The infections that usually affect your sinuses, your throat. Okay, for example, if you have common cold, epiglottitis, laryngitis, pharyngitis, sinusitis, okay, that will come under the upper respiratory tract infection. Okay, yeah, like any even flu, most of the flus that you get, okay, that usually affects your upper respiratory tract. Okay, pneumonia and all is when the lower respiratory tract is involved. Okay, so common cold and all, you feel heaviness in your head. Okay, heaviness in your head, under your eyes, and all around your eyebrows and all, you feel certain heaviness, discharges, runny nose. Okay, so in all these conditions, these signs and symptoms are quite common. Okay, epiglottitis is like when you have a sore throat and all. Okay, when you swallow, you find it difficult to swallow, you have pain while you're swallowing. Okay, so that is sore throat, pharyngitis. Epiglottitis, the epiglottis that covers your sound box, okay, your voice box. It's a tissue. It's a small tissue in a triangular shape that covers your, it's kind of in a leaf kind of a shape, okay? It covers your larynx. So that gets inflamed. That is epiglottitis. Okay, when your voice box undergoes inflammation, when you speak a lot, okay? Usually it happens to singers and rock stars and all when they practice a lot for a stage performance before their concerts or something like that. They get laryngitis, their voice box is gone. Okay, they don't have any sound. You speak a lot for 2 3 days. Okay, you for example, for a wedding or reception, okay, the bride or a groom or their parents have to speak a lot with a lot of wedding guests and all. Okay, by the end of the day, their sound is gone. It's kind of laryngitis. Okay, their sound box is inflamed because of overuse. Okay, sinusitis, it's infection in your sinuses. Sinuses are this hollows in your skull. Okay, they're supposed to be filled with air. Sinuses are supposed to be filled with just air. And because of the sinuses, you don't feel the weight of your skull. Okay, your head actually is a very heavy part, including your skull, the weight of your brain and all. It's a heavy part, but you don't feel the weight. Generally, you don't feel the weight of your head Why? Because the sinuses and your CSF fluid. For the brain, it is the CSF fluid. The brain floats in the CSF fluid. Okay. So that's why you don't feel the weight of the brain. And sinuses are these hollow air pockets in your skull. Okay. And that makes the skull feel lighter. Okay, so that's the function of sinus. But when it undergoes any infection, sinuses, when they undergo infection, it is filled with fluid, mucus. Okay, so that's why you feel that heavy headedness. You kind of feel the weight because now instead of air, there is some mucus secretion that's taking place. So that's how you feel that heavy headedness feeling. Something is blocking your nasal pathway. Okay, runny nose, that frequently happens. So that is why, these are the common things that happen in the upper respiratory tract infection. Lower respiratory tract infection, it usually affects your airways and lungs. Am I audible to all? So lower respiratory tract infection, it affects your lungs, airways. In generally, they are longer and they are more serious. Okay, because whatever has been trapped here, it could be dust, bacteria, virus. Okay, anything that has been trapped here or any material that you have aspirated. What is aspiration? Something that is supposed to go into your food pipe, your esophagus. It if you sneeze or cough while eating food, okay, or if you are eating food very fast. So things that are supposed to go into the esophagus, your food pipe, they end up in your windpipe, the trachea. So that's aspiration. Okay, so these trapped particles can also cause inflammation and infection. Okay, so these trapped particles, wherever they are trapped, they have to be moved out of here, and they have to get back into the upper respiratory tract and it has to come out of either your nose through runny nose. Okay, it has to be out of your system. Okay, so it takes time. Okay, so that's why lower respiratory tract infection are much longer and they may be serious. Okay, you may get admitted. Okay, in some severe cases of pneumonia and all, ventilation is also required. Okay, so bronchitis, your bronchi that undergoes inflammation that causes coughing and fever. Okay, bronchiolitis, as I mentioned, these small branches that you see, these are the bronchioles. Okay, if there is inflammation in the bronchioles, that is bronchiolitis. Okay, chest infection because of any external trauma like a stab wound, gunshot wound. Okay, any traffic accident trauma. If you get your ribs fractured, okay, and the fractured part of particles of the rib or the fractured part of the rib may poke into your lungs. Okay, and that can cause infection. Okay, so these are physical traumas that can cause infection. And there is also a pleural layer that covers your lungs. If the pleura gets infected, okay, if there is edema, edema and all, that can also lead to infection. Excuse me. Pneumonia. Pneumonia also something gets trapped into your windpipe, your trachea, bronchioles. Okay, that will cause inflammation. Okay, that is pneumonia. So whenever any inflammation happens here, your alveoli, as I mentioned earlier, your respiratory tract, they end into the alveoli. These are the air bags. They're supposed to be filled with air. They take they when the lungs expand, alveoli are getting filled with air when you breathe in. And when you breathe out, alveoli will create a negative pressure and all the air is out of the alveoli. So they are like airbags. They come constantly depuff and puff up with air. Okay. So they are supposed to be filled with air, not with fluid. Okay. So when inflammation happens, there is swelling. Inflammation, swelling will also happen. So because of that swelling, all the extraterrestrial uh, fluid that will seep into the alveoli. Okay, so alveoli gets filled with fluid. There is less oxygenation. Okay, if alveoli gets filled with fluid, that alveoli will not be able to take up oxygen into the blood circulation. So lack of oxygenation, breathing difficulties will take place. Okay, so these are the main difference between upper and lower respiratory tract infection. Is it clear to all so far? So what causes upper respiratory tract infection? Okay, it can be because of virus, bacteria, even dust particle that enters your respiratory system. Okay, either you may touch some infected surface in hospitals and all when you go to hospitals, and if you don't wash your hands and touch your body, touch your nose, you might transfer infection within yourself. Okay, germs from your hands can also infect your own body. So usually it's viral infection, bacterial, fungal, allergies also can lead to infection. Okay, some dust particles that get trapped and cause infection. Nasal polyps or tumor. Nasal polyps, more than 50% of the population has nasal polyps, usually on the right nostril. Okay, if you get time, you just look into the mirror. Okay, pull your chin up and look into the mirror. Use a flashlight. Okay, and visualize your right nostrils. Okay, inside you will find a mass there. Okay, so that is polyps. Mostly majority of the population has polyps. That can also cause, if polyps keep on growing and it is blocking your breaths. Okay, that can also cause infection. Deviated nasal septum, that is also very common. Okay, when you touch the tip of your nose and slightly press the tip of your nose. Okay, and see to which direction. If you see in the mirror and you do this, touch the tip of the nose and press it slightly. Okay, if you see which towards which side your the bridge of your nose is going. Okay, it should not go to any of the either side. It should just, when you press the tip of the nose, it should just bend inwards. Okay, it should not go to either side of line, neither left or right. If it is going either left or right, it means you have a deviated nasal septum. Okay, so people who have deviated nasal septum also have a risk of frequent respiratory infections. Okay. So who is at the risk of upper respiratory tract infections? It can, like if it is common cold and all, anyone can catch it. Okay, but certain group of people, they are at more risk of developing um, respiratory tract infection as compared to others. Children are at the highest risk. Okay, it's respiratory infections are fairly common among children. They are at the highest risk. And it is often children who might be carrying a virus as well because they go play outside. Okay, children do get physical with each other. They fight, okay, or they play games in which physical contact is necessary. So they may always, they're always at the risk of catching infections from other kids. And they also, if they're eating out, okay, even if you packed tiffins for them and they're going to eat their tiffin, even how if they have been told to wash hands, usually they will skip. Okay, they rarely they will wash their hands before eating, just like adults how they are uh, trained in this. Kids usually miss out on it. Okay, people who have heart or lung problems, smokers or people who have history of asthma, bronchitis, heart problems like ventricular septal defect, atrial septal defect, and all. Okay, VSD, ASD, and all. So that can all these can also lead to lung infections, respiratory infections. People who have weak immune system. Okay, children who are prone to frequently getting infection, kids who didn't get were not breastfed enough. Okay, low birth weight babies and all, those who have weak immune system, they are at the highest risk of getting infections. How do you diagnose respiratory infection? Not much physical examination is required. Based on your symptoms, it is known to the physician that this is a respiratory infection. Okay, but an ENT specialist and all, they can look into your nose, ear, throat, listen to your chest. Okay, using stethoscope. Where do you have congestion? Okay, the sound of your breathing, any regurgitation that is happening, some murmurs that is happening, that can be heard through your breathing. You often do not need any other test, but in some cases, if the provider is concerned that you may be suffering from some serious respiratory infection, or if it is a lower respiratory tract infection, just to confirm that, they may ask you to take a lung chest X-ray, a CT scan, pulmonary function test, PFT test is done to see uh, the extent of your asthma or bronchitis. Okay, people who have asthma and bronchitis regularly, pulmonary function test is done. Okay, just to see how your lungs are working, what is the capacity of your lungs. Okay, nasal swabs can be taken to identify which organism is causing infection. Throat swab, nasal swab, sputum test to identify if the patient has tuberculosis or any other infection. Okay, they have to spit out the sputum into a sputum collection container. Okay, outside, not inside any room. When you're asking somebody to collect that sputum in a sputum container, always remember, guide them to go out in an open area, well ventilated open area. There they have to cough up the sputum and put it into the container, spit it into the container, and send it for testing. Okay, do not encourage sputum test in a closed room. Then upper respiratory infections are contagious. They can pass from one person to another, okay, through respiratory droplets or hand to hand contact. People who have an upper respiratory infection can also pass it to others through sneezing or coughing. If they're not covering their nose and mouth when they're sneezing and coughing, okay, they can spray germs into the air. Other people can also breathe in those germ-filled droplets and get infected. And sneezing and coughing into your hand and without washing it, if you are touching someone else or touching somebody else's articles, okay, even if you're not directly touching someone, if you're touching public places, public areas, okay, you're leaving the markers of infection everywhere and others will get infected. So symptoms of upper respiratory tract infection, you will have cough, fever. Infection always comes with fever, remember that. Okay, Infection will always come with fever. Increase in the body temperature will happen if there is an infection. Okay. Hoarse voice, your voice changes. Even when you have common cold, you see how your voice changes. It is more deep and husky and all. Fatigue, lack of energy, red eyes, runny nose, sore throat, swollen lymph nodes, swelling on the either side of your neck, that is swollen lymph nodes. You can feel it. Okay, if somebody has suffered from mumps, okay, that is severe kind of swelling. But even if you have mild to moderate infection, especially if it is upper respiratory tract infection, lower lymph nodes are swollen. If it is lower respiratory tract infection, the lymph nodes near your armpits and all those become swollen. How long do upper respiratory infections last? It may last typically 1 or 2 weeks. Okay, most of the time they go away on their own. Any over-the-counter pain medication can also help you feel better. And make sure that you drink plenty of fluids to stay hydrated. Okay, don't get dehydrated during your infection. And if at all the symptoms is lasting long, okay, within a week you are not able to resolve your respiratory infection, you will require medical help. Okay. And if there is any underlying condition that is not yet been diagnosed, that will be diagnosed. Can antibiotics treat upper respiratory infection? Most of the time, yes. But if it is viral infection, antibiotics cannot help you. Antibiotics are only for bacterial infections, not for viral infections. Okay, viruses don't respond to antibiotics. Okay, for viral infection, antiviral medications has to be used. Painkillers, if there is severe headache along with infection or body pain along with infection, killers can be given. Penicillin and amoxicillin are the most common antibiotics prescribed if you have a sore throat and all. If it is a strep throat, streptococcal infection. Strep throat means strep is it's a short name for a bacteria, common bacteria. Okay, streptococcal infections of your throat is called streptococcus. Then antibiotics should not be prescribed for common cold. Common cold is caused by rhinovirus. Okay. Sardi Zukam, what we say, common cold is caused by rhinovirus. It's a viral infection. Taking antibiotics for common cold does not help. Okay. And should be considered only for specific secondary bacterial infections like sinusitis, streptococcal pharyngitis, otitis media, bronchitis, and in all this inflammation, if a bacteria is present, that's when antibiotics will be prescribed. Based on which type of bacteria, you have to check that as well. Okay, which type of bacteria is causing the infection? Based on that, different classes of antibiotics are there. Okay. Narrow spectrum, broad spectrum, class 1, class 2, class 3. There are different categories of antibiotics for some specific bacteria. Only that class you have to use for that specific bacteria. Do not prescribe antibiotics unnecessarily. Otherwise, it will lead to resistance. Your bacteria is also, the microbiome is also getting smarter. Okay. Earlier, the number of bacteria that penicillin could kill, okay, now it is reduced to very few bacteria that respond to penicillin. Okay, now higher quality antibiotics, more expensive antibiotics, the newer versions of antibiotics, which are more expensive, okay, and exhaustive in preparation is required to treat some bacterial infections. It's because of resistance. Over a period of time, because of the abuse of antibiotics, your bacteria have learned how to overcome antibiotics. Okay, so that is what we call as antibiotic resistance. If you have these symptoms, you have to check with your doctor. Okay, just because of your respiratory tract infection, you are losing consciousness. There is high fever, more than 103 degree Fahrenheit. Okay, that is high fever. Normally, your normal body temperature should be around 98.6 degree Fahrenheit. Okay, if it is higher, you're feverish. 103 is high fever. Okay, there is rapid breathing, difficulty in breathing, breathlessness, okay, severe coughing, frequent, and along with coughing, blood also comes out, or sometimes you vomit. You end up vomiting because of severe coughing sprouts. Okay. Wheezing is a high-pitched whistling sound that comes when you breathe. Okay, it happens for asthmatic patients and bronchitis patients. Even when if you can't hear it clearly, if you use stethoscope, you can hear it. Okay, wheezing, it's a whistling kind of a sound that comes in and goes when you exhale and inhale. Okay, so that is called wheezing. Then dizziness, it is lightheadedness. Some respiratory tract infection can lead to migraine. Okay, severe headache and all could cause migraine, and that could lead to dizziness. Retractions is if anyone who suffers from asthma or bronchitis would know, when you are undergoing that breathlessness phase, you have not yet took your pump, your inhaler. If you look at yourself in the mirror, the way how you breathe, you can see your rib cage coming out and in. You can see the entire movement of your rib cage through your skin. That is what we call as retractions. Okay. And this is more obvious in children because they have less subcutaneous fat. Growing children, okay, the subcutaneous fat is that the skin is very thin. So it is more visible, evident in children. Then you have stridor. Stridor is a harsh, raspy vibration that happens when you breathe. Okay, again, with stethoscope, it can be heard more clearly. Even without stethoscope, you can hear it, but with stethoscope, you can hear it more clearly. Okay, and it is more common in children as compared to adults. Coming to nutritional consideration, diet is a very significant factor in immunity. Macro and micronutrient deficiencies have to be taken care to make sure that your immune system is functioning properly. Okay, and it can also, if you are well nourished, the risk of developing upper respiratory tract infection, and even if you develop upper respiratory tract infection, the duration of it is under control. So, which are the nutrients that benefit? Zinc. Zinc can inhibit rhinovirus. Rhinovirus causes common cold. Okay. So having enough zinc in your body can inhibit rhinovirus, and also taking zinc supplements. Okay. Viruses, how they cause infection, they replicate themselves. They create copies of themselves using your own DNA. That's how they spread and cause infection. So using zinc supplements, it has been seen that in 42% cases, zinc supplements, after using zinc supplements, the duration of suffering from common cold has been reduced. And fatty acid, omega-3 fatty acid, fish liver oil, flaxseed oil. Okay. Supplementation of this can also reduce the incidence of getting upper respiratory tract infection, especially in infants and children. Vitamin D supplementation, it is a controlled research that they have done. Okay, it has been seen that vitamin D supplements have significantly reduced the incidence of upper respiratory tract infection. So if you are deficient in vitamin D, your risk of getting upper respiratory tract infection also goes up. Vitamin C. Vitamin C is also, we all know, it prevents and treats cold. Okay, it's widely accepted as well. We don't have much regular evidence, but some mega studies have been conducted that supports the efficacy of vitamin C, okay, for respiratory infection, but it has to be mega doses. High amount of vitamin C can tackle the infection. Especially for individuals who are under physical strain and physical or environmental pressures like marathon runners, okay, people who work out a lot, out and about, uh, skiers and those who go for skiing and all, okay, soldiers who are exposed to severe cold. Okay, for these section of the society, if mega doses of vitamin C is given, the chance of getting a respiratory infection is significantly low. So that's about upper respiratory tract infection. If you have any queries, please mention in the chat box.